Hi, I'm Dr. Hashimoto. Today we're going to be talking about knee pain. Treated thousands of patients with chronic knee pain. And this video is going to go over all the different things you can do to start reducing knee pain right now, today, in your own home. In the next 90 seconds, we're going to be talking about inflammation and why it's the enemy and how you can reduce that and why that causes knee pain. So over here, first thing that we're going to talk about is we're going to talk about diet. A lot of doctors don't talk about diet, but I think diet is one of the first things I recommend. We all know that if you lose weight, if you're overweight, it's going to take a lot of stress off of the knee. They say that for every pound you lose, it's 4 pounds of stress off the knee. That was Dr. Mesner's study, and anyone that's lost any weight with chronic knee pain, they'll notice that they feel better, and they notice that when they gain weight, that their knee pain will be a lot more. So weight loss is not the only component to knee pain and inflammation. So another thing that we're going to talk about is reducing that naturally. So the main thing you really got to do is you got to eat a healthy diet, natural food. So I just say if it didn't exist on the planet thousands of years ago, you probably shouldn't eat it. So there's way too many preservatives and junk in the food. So whether it's soda, alcohol, bread, pasta, chips, fast food, all those different things are going to be bad for you. So you want to eat maybe a little bit of fresh fruit, some healthy fats, some healthy protein, and with vegetables, essentially you're going to avoid the nightshades. So that's going to be the eggplant, that's going to be the tomatoes, that's going to be the bell peppers, things like that. So the nightshade vegetables are a source of inflammation. If you really want to get granular on that, you could eliminate the skins and the seeds, but I say just start eating more whole food and getting rid of that processed food. Now, when it comes to other things that you could supplement your diet with, one of the things that I like to do is recommend a cup of bone broth. Bone broth is good for anyone with rheumatoid, psoriatic, or any other kind of autoimmune disease, but it's also good for anyone with chronic inflammation. So in your digestive tract, you have these, sometimes people get these tiny little perforations in their gut, and that's something called leaky gut syndrome. And one of the easiest ways to treat that is with bone broth. So I recommend a cup of bone broth a day, and if you Google bone broth recipes, you're going to see a lot of different things. But I'll tell you how to make it really quick. You can buy it, but you can make it quite easily. So you can buy a thing called an Instant Pot, which you can buy on Amazon for about 80 bucks. And then you get some beef bones in there, chicken bones, and you pop it in there. I like grass-fed and free range. You put a little bit of vinegar in there to extract the nutrients out of there, and then obviously you're going to put water in there. And then if you want to add some flavor to it, you could add bay leaf, some onions, some carrots, different things. And you pop it in there for 2 hours and you set it and you forget it. If you're going to do it with a crock pot, it's going to take about 1 to 2 days to extract all that healthy hyaluronic acid that you're going to coat your intestines with. So 1 cup a day. You could put it in a shake, you could just drink it straight. I have a cup of bone broth. It's good for your hair, skin, and nails. So bone broth is good for a lot of things. Other things you could take is glucosamine, chondroitin, and all these other supplements to reduce the inflammation, turmeric, ginger, boswellia. However, when you take all these different supplements, you want to make sure that it comes from a good manufacturing practice supplement company. So it's going to say GMP on the bottle, and that just means what's on the bottle is in the bottle. So if it says 100 milligrams, it's going to be 100 milligrams, and it's going to be good for you. So there's a wide variety of different companies out there. I'm not going to pick one over the other. I just make sure that it's a GMP certified. So that is inflammation reduction on your own. Now let's talk about some other things. What is inflammation and why is it bad, and where do you get it from? Well, essentially with your joints, when we look at the knee joint, it's supposed to be nice and smooth like this. And when you're born with this nice smooth joint, it glides really well and doesn't really produce a lot of inflammation. And the reason why they call it degenerative joint disease or joint decay, it's because the joint has begun to decay. So these parts start breaking down. So think of it like a piece of wood that you've left outside for a long period of time that began to decay. So it starts to get rotten over here, a little bumpy. And then when it tries to rub on each other, it creates a lot of inflammation, a lot of friction, and a lot of pain. So you go to your doctor and they want to help you. So what do? They give you a non-steroidal anti-inflammatory. Some Aleve, ibuprofen, diclofenac, Voltaren, you name it, they're going to give you that anti-inflammatory. And that will make it feel better in the earlier stages. But if you're suffering from a degenerative change or a chronic meniscus tear, it's not a good long-term solution, which can lead to kidney problems in the future, internal bleeding, blood pressure issues, and you name it. So then, if that's not working, you might go get a cortisone shot. And I'm not saying that we don't do cortisone shots here in the office, but again, it's not a real good long-term solution. So the cortisone is going to reduce inflammation in the joint, but it's also going to erode a little bit of the cartilage, setting you up for that future knee replacement if it's something that you're trying to avoid. So we like to reduce inflammation in other means. Not saying that we don't do any of those other things, but if it's a chronic degenerative problem, we look into other solutions. So I talked about diet. Another thing you could do to reduce inflammation is adding stability to the knee. So you have muscles all around the knee. You got your quad, hamstring, calf, and then lower abs and glutes. I have some other videos on that is going to discuss how to improve stability for the knee, but essentially what we're going to do is strengthen and activate those muscles around it. Now, if you want to reduce inflammation without a medication, one of the things that we do is a deep tissue laser. So I'm putting glasses on right now because it emits a little bit of radiation with this. It's not kind of radiation that you have with an X-ray. And then it has photons of light that is going to increase the ATP production in the joint. It's going to feel like a very, very warm light, or kind of almost like you're in a tanning bed per se. And then so you're going to feel some heat with that, but that's going to release ATP in the joint. And then what that is going to do is reduce inflammation, and it's essentially going to make you feel better faster. So we'll use laser in our office quite frequently. Again, it's not an end-all be-all, but it is a type of solution. Another thing that we'll do is we'll do something called shockwave therapy if you're suffering from a chronic tendonitis or tendinosis. So it's going to sound like that right there. It's slightly uncomfortable, but essentially what it is waves of energy going faster than the speed of sound that blast into the tissue to break up those little knots and adhesion. So if you're having chronic knee pain from a tendinosis, then we'll use some shockwave therapy. And it's not uncommon for us to do that before a stem cell, a PRP, an exosome, or an amnion injection. So what are those types of treatments? So this video is going to be a little bit shorter, so I don't have enough time to go into stem cells, growth factors, and PRP, which is why I have a link below right here where you can watch a video on that. It's about 40 minutes, and it goes into detail what they are. But I like to make things a little bit simple. So think of a stem cell as a construction worker. Construction worker can build things. So people talk about how many stem cells they put into a joint, and yes, it is kind of important. The more construction workers that are on the site, the more construction that can happen. However, they need tools. So your growth factors are the tools for that construction worker, and that's going to be things like PRP. It's going to be the growth factors in your stem cells, and when you combine the construction worker with the power tools, you're going to get better work. And then you have something called an exosome. Exosome, think of it as a cell signaling. So think of that as a superintendent on the construction site. They're not doing any actual work, but they're pointing their fingers and they're telling the construction workers to go over here, pick up these tools, and get to work on that project. And that's kind of like the simplest way I could explain it. We do a lot of platelet-rich protein in our office, and not all PRP is the same. The main differences that we do in our office is we're going to draw off more blood, so we're going to get a higher concentration of PRP. And then we have this monodose gel, which is this special cytokine growth factor that's going to help us get a better yield out of that the PRP itself. And then we'll treat it with a special type of laser to activate the growth factors in that. And we'll actually cool it a little bit to activate it a little bit more. And then once it's all prepped in there, depending on the type of condition we're treating, we could also turn it into a type of gel, or keep it in a more liquid phase, and then we'd inject it into the tendons, ligaments, or in the joints. And then when we inject it, we're going to either use fluoroscopy or ultrasound to make sure that we get the needle in the right spot. So depending on the type of procedure, we'll determine the type of imaging that we use. We like fluoroscopy in our office. The downside of that is the patient gets a little bit of radiation. So when we can, we always use ultrasound. So again, I'm encouraging you to watch that 40-minute presentation that explains the stem cells, PRP, and exosomes quickly. I'm sorry for talking a little bit quick, but it had a lot of information to get through. This is Dr. Hashimoto signing off. Look forward to seeing you in the office.